Hello and welcome to Golden Canopy Health Management, where we are dedicated to ensuring health, enriching life, and embracing retirement. My name is Kevinly, one word like heavenly, and today we are going to cover a crucial aspect of health in terms of Medicare, and it is eligibility requirements. We need to know how one can qualify for Medicare when they're approaching 65 years of age. We'll also go over cost involved with signing up. We'll go over the sign up process and how Golden Canopy Health Management can help and assist you on your Medicare journey. First, let's talk about eligibility and requirements. There are several ways to qualify for Medicare when you're approaching 65 years of age. The first is age and citizenship. You have to be 65 years old or older, and you also have to be a U.S. citizen in order to qualify for Medicare. That's one way, which is the most common way people in America qualify for Medicare. You also need to be a U.S. citizen or a resident of the United States in order to qualify for Medicare. And if you are a resident or a legal resident, in order to qualify for Medicare, you have to have had lived here in America for a minimum of 5 years in order to qualify for Medicare. So one of the first requirements is age and citizenship. So let me give you the official bullet points. You must be 65 years old. The most common way most people qualify for Medicare as they approach 65 is being 65 years old or older and being a U.S. citizen. And if you're not born here in the U.S., you need to become a U.S. citizen or a permanent legal resident. For permanent legal residents, you have to have lived 5 years consecutively in America in order to qualify for Medicare. The next requirement is work history, which is another requirement in order to apply for Medicare. Now, work retirement falls under if you or your spouse have worked in the U.S. for 10 years or more, then they have paid enough tax into the Medicare system for you or your spouse to qualify for Medicare. So it's 10 years, which also equates to 40 quarters. That's another way to qualify and meet the requirements to receive Medicare. Now, if you came to the country later, like say 62, and you've only been working for 4 or 5 years, you would still be eligible for Medicare. Now, you would need to have 5 years or more in order to apply if you are a permanent resident in the United States, because you would still qualify for Part A, but you would have a premium for Part A. The reason why a legal resident who had become a U.S. citizen later on in life would have a premium for Part A is because those of us born in the States who have worked 10 years or more have already paid into the Medicare system through our taxes. So that is why Part A for most Americans would be at no cost, because we have already paid into the Medicare system. Now, if you're a legal resident and you've worked for 5 years or less, then you can still get Medicare Part A if you're over 65, but you would have a premium because you have not paid enough into the Medicare system to where your Part A would be without cost. So you have to work a full 10 years to qualify for Medicare, which is a 40 quarter time period, 10 years. And that's how you would qualify for Medicare through your work history. Again, you or your spouse had to have worked 10 years or more and paid into Medicare taxes in order to qualify for Medicare. Or if you are a legal resident, you have to have had worked 10 years or more to qualify. But if you haven't worked 10 years, if you're a legal permanent resident, you can still get Medicare after the age of 65. If you've worked less than 10 years, there will be a premium for your Part A participation. Now, there are also options for individuals who are younger than age 65 who can still qualify for Medicare. Now, if you're under the age of 65 and you are currently receiving Social Security Disability Insurance, SSDI, for at least 24 months, you are eligible for Medicare. So if you're under 65 years of age, you are drawing Social Security Disability Insurance, and you've been doing so for 24 months or more, you are also eligible for Medicare regardless of your age. And those with end-stage renal disease, which include permanent kidney failure requiring dialysis or transplant, would also qualify for Medicare regardless of their age. So again, if you have end-stage renal disease or permanent kidney failure requiring dialysis or transplant, no matter your age, you'd also be eligible for Medicare. And individuals with ALS, also known as Lou Gehrig's disease, are also eligible for Medicare as soon as they start receiving their SSDI, Social Security Disability Insurance. Those with ALS would not need to wait 24 months to start receiving or start qualifying for Medicare. So now let's discuss the costs associated with Medicare. It's important to understand that while Medicare does help cover healthcare costs, it is not entirely free. So let me say that to you one more time. It is important for you to understand that Medicare, while it does cover Medicare costs and helps with your Medicare, it is not entirely free. So let me break down to you what that means. Part A is hospital insurance, usually free if you or your spouse have paid into Medicare through paying taxes for at least 10 years. This covers inpatient hospital stay, care in a skilled nursing home, hospice care, and some home health care. If you haven't met the 10-year work requirement, you may pay a premium up to $506 a month, according to 2024. So, Part A, if you or your spouse have worked 10 years or more and have paid taxes, you do not have a premium for Part A. If you have not worked and met the 10-year work requirement, in 2024 for Part A, it'll be $506. Each year, the price does go up. So next year, when I put out more video content, the price will be different. So that's the cost associated for Part A. If you've worked more than 10 years, there's no cost for you when you turn 65 because you've already paid into it through taxes. If you are not a citizen or you're a legal resident, you will pay a $506 a month premium if you haven't worked the 10-year requirement. Part B, which is medical insurance, requires a standard monthly premium, which was $164.90 in 2024. Although this can be higher depending on your income, Part B covers outpatient care, doctor service, preventative service, and some home health care. So the cost associated with Part B as of 2024 is $164.90. Each year, that does go up. Now, that is a price that is set by the U.S. government, that is a price that is set by Medicare, and that is non-negotiable. So if you've worked 10 years or more, you get Part A at no additional cost because you've already paid into it through your taxes. But Part B, there is a current premium for it, which is $164.90 as of 2024. Now, Part C, which is Medicare Advantage, and I will be creating video content to explain that as well. These are private plans that offer all Part A and Part B benefits and often include additional benefits like dental, vision, and health and hearing. Costs vary widely depending on the plan and provider. So we haven't covered Part C yet, and Stay tuned because I will here shortly. But Part C is Medicare replacement plans, is what they used to be called. Now they're called Medicare Advantage. So what that means is that they are private insurance companies, and I'll go over the pros and cons of that does everything Part A and Part B does, which is hospital insurance and medical insurance, but they also add things like vision, dental, hearing, which is super important as we're aging. So that is Part C, and the cost for Part C is usually the same cost of Part B. So what that means is if your Part B premium is $164.90 as of 2024. If you decide to go to Part C, the premium will remain the same. Part D, which is prescription drug coverage, I have not yet created a video for that as well, and I'll do each of those with more detail in the future. Also offers a private insurance company. The cost and coverage vary by plan. This helps cover the cost of prescription drug, which can be significantly expensive in retirement. So I'll cover Part D as well. And Part D is solely drug plans, and the costs, depending on the plan, depending on which program you pick, which is why it's important to have a consultant like someone from Golden Canopy Health Management to help you walk these process and plans out. Now let's talk about signing up for Medicare. Signing up for Medicare is straightforward. You know, you would need to reach out to Golden Canopy Health Management, and we can help you through that process. Look over your options, look over your wants, what is it you're looking for. You could also go to www.ssa.gov, which is another way to sign up for Medicare as well. The benefits of going through Golden Canopy Health Management is someone from our team has studied, are up to date on all the policies, procedures, and not to mention there are over 3,000 plans to choose from, and having someone there to navigate that with you and walk you through that process is very helpful and beneficial. Down below you'll find the contact information for Golden Canopy. The navigation of Medicare is very, very complicated, and what I've discussed today is very brief. So our team a team of experts will help you with understanding your options, compare your plans, and enroll you in the best plan possible. Golden Canopy's mission is to ensure health, to enrich life, and to embrace retirement. So we will make this process as smooth and stress-free as possible. We're committed to ensuring health, enriching life, and embracing retirement. So please contact us today, get a hold of us, and we'd love to help you and walk you through your Medicare journey, your Medicare process. Thanks again for watching Golden Canopy Health Management. Please like, please subscribe, please hit the notification bell, because we will be putting out video content every Tuesday and Thursday about Medicare to empower you, to give you information so that you understand what your options are. Thanks so much, and see you next time.